Thanks for tuning in to the Drive On podcast, where we're focused on giving hope and strength to the entire military community. Whether you're a veteran, active duty, guard, reserve, or a family member, this podcast will share inspirational stories and resources that are useful to you. I'm your host, Scott DeLucio, and now let's get on with the show. Hey everybody, welcome back to the Drive On podcast. Today, my guest is Dr. Jen Blanchette. Dr. Blanchette is a therapist whose focus has been working with trauma and the nervous system, and her clients include people who have experienced trauma like traumatic brain injuries and other types of things like that. And she's here today to discuss the connection between the various traumas that people have endured through their brains and how they affect us, and also, more importantly, what we can do about all of that type of stuff. So welcome to the show, Jen. I'm glad to have you here.
I'm so glad to be here. Thanks for having me on.
Yeah, absolutely. So why don't you tell us a little bit about yourself and your background and the types of work that you do with your clients?
Yeah. So, by training, I'm a clinical psychologist, and I also have been trained in EMDR therapy, which is eye movement desensitization and reprocessing, which is a lot of psychobabble for I've been trained in trauma therapy. I also am a certified heart math practitioner. So, I do a therapy called biofeedback, where we're looking at your heart rate variability and the ability for the intelligent heart to be able to regulate your nervous system. A lot of the folks that I work with have suffered from trauma. They deal with panic attacks or anxiety. So their nervous system needs that retuning. So I find that's a really helpful modality that I use with folks. So that's another thing I do. I trained in Virginia, so a lot of maybe former Navy veterans. I lived in Norfolk for probably 10 years, and in the counseling center at Regent University, we would frequently see service members. And I think just going to college around that environment, dating a few Navy guys myself, honestly, kind of helped me keep a pulse on military culture a little bit. And I think I certainly have always seen a service member throughout the years on my caseload. And I just really have a big heart for their struggle. And my heart goes out to all of the sacrifice that they have given to do what they've done to protect our country. So I feel indebted to them as well to continue this work. So yeah, any questions from what I've said?
Yeah, no, I mean, that's great. And I love getting that kind of support and feedback from people who, they may not have served themselves, but they are out there trying to work to better the military and the veteran communities to kind of give back to those people. And, we really appreciate people like yourself who are out there doing this type of work, because without people like you, we are not going to be as strong as we could be, or as resilient and bounce back from the issues that we might be facing. So we appreciate that. And so we thank you for the work that you do as well. Let's jump into this. Let's talk about various types of brain injuries, because unfortunately, those things are common amongst people in the
Very
military.
common and much more common than the civilian population because of the
Correct.
nature of what folks have been through in the military. So I'll just kind of go over the building blocks of brain injury. So you certainly have acquired brain injury, which is our umbrella term over all of brain injury. So there's internal causes of brain injury that would be like a stroke, an aneurysm. And folks who have actually had a TBI are more inclined to have one of those. So it's important to think, just because mine is in the TBI category, I had an external force. So that's the other side. So it's internal and external. So more often than not, folks in the military might have had an external force, a traumatic brain injury, whether that be a blow to the head, so you could have a closed head injury or an open, where something has actually punctured the skull. So that could be shrapnel or other types of things that might have punctured the actual skull. So there's open and closed in that TBI external category. And a lot of injuries, majority of them are closed. So the traumatic brain injury, it's called the invisible injury for a reason, because we cannot see it and no one can really know the effects. And oftentimes we don't see any of that on brain imaging. So I think it can be maddening for anyone with a TBI who struggled with this because, okay, I had an injury to my leg. People can see that. They can see that I have this injury. And so they kind of know maybe something happened to me. If you have a TBI or something has happened in your brain, there's no indication to other people to know something is wrong. And same thing with trauma. Like they can't see the trauma that you're carrying inside your body, inside your mind, and your heart. So they're not readily understanding that you've been through this very difficult experience. And with the brain, it's the driver of like drive on. It was driving on everything that's happening in the body. So yeah, I think it's important for service members to realize that the general public don't really get it. They don't really have great education on TBI, on brain injury, on concussion. Even though we see, in the football arena, for example, oh, this player had a concussion, they're on protocols, and then, they're back. But there's no really discussion of what it's like for them to deal with that concussion or to deal with persistent symptoms after concussion or TBI.
Yeah, and that's an important point I think that you bring up because not only should the service members and the veterans who have experienced some of these things recognize the fact that other people may not understand what they're going through. They may look at them and say, well, he or she looks healthy. They look perfectly normal. They look fine. But why are they acting this way? Right. But I think it's also important for the people who are around them, the family members and people like that, to recognize that if something seems off with the person, it seems like they're, behaving differently, they're forgetful, there's a whole list of symptoms, and I'm sure you could talk more about those types of symptoms. But if you're recognizing that some of these symptoms are popping up and you can't quite pinpoint why these things are coming up, well, it could be related to something like a brain injury that they may have experienced during their service, and they may or may not have even told you about it because maybe they didn't want to bother you about it or something like that. You know what I mean?
Yeah, or there's so many reasons why I think perhaps they might have not gotten treatment. The service members I've worked with, I think certainly they've talked to me about, you can speak more to this, I'm sure, about military culture and needing to deprogram kind of that we're just going to move through it. We got to get through it. We got to get the job done. I'm talking in that kind of male voice behind me, although we know we have female service members that might be listening to this. But I think that voice is there too, regardless of gender. So, or I'm just thinking of a veteran who didn't want to be taking off of a certain type of status. If I have a problem, if something is wrong with me, then I can't do my job. That means they're going
Right.
to take me off of my job. And what does that mean for me? So they might minimize symptoms or neglect symptoms despite having symptoms.
Yeah, no, that's absolutely true. There is that stigma that your job is going to be in jeopardy or you're not going to be able to continue working in an area where you may need certain clearances or whatever the issue might be. There is that stigma, and you're right with that inner voice that we might have, whether it's a male or a female. I think there's a lot of those alpha kind of personalities in the military where we're just going to get the job done. Like, and the heck with the consequences. We're not worried about any of that stuff because we're invincible and none of this stuff is going to matter. So we're just going to keep pushing through and, you know, deal with whatever later. And so that is definitely stuff that happens. And then over time, you might not even think about it. It's like, well, I was able to finish that mission. I was able to finish the next mission. I was able to keep going. Why am I all of a sudden now experiencing all these symptoms? It couldn't possibly have been that because I've done so much in between then and now, and so that might be the thought process that goes through someone who's experienced some sort of brain injury. But one of the symptoms is kind of a confusion, a lack of rational thinking. And so they may just not be thinking clearly. But you could talk more about some of the symptoms that people may be experiencing too, just to keep people aware of that type of stuff.
Yeah, I would say the symptoms vary. So that's always a fun part of concussion and brain injury is that they vary really dramatically because I think there's different parts of our brain, right? So if there's like in concussion, often we talked about diffuse axonal shearing. So in the brain, we have neurons and we have axons. And it's like, The brain is really like yogurt that's in a tight container. So if we shake that yogurt up, all those little molecules have changed position, but if we open the container after we've shaken it, it doesn't look that different, right? But functionally, if that's our brain, it's very different. Also, the example I've heard before is like a stretched out t-shirt. Yeah, it's still a t-shirt, but it's very different. And it looks very different. So I'm trying to think where I was going with that example of different symptoms. Yeah. So one of the biggest symptoms is headache, difficulty with attention. A large percent of our brain is also attributed to visual information. So one of those symptoms can be visual difficulties, vestibular or inner ear problems that I see is frequent. And what can happen sometimes with service members if maybe they had a concussion, TBI in the service, they recovered from that, maybe they were able to go back to work, and then they had another subsequent blow to the head after service, right? Well, what we know is that concussions stack on top of each other, and trauma makes it worse because that's another cognitive load on the brain. And there's an interesting graph that I show from the VA where they overlay the symptoms of TBI and PTSD. And there's a lot of overlap. So I think it's important to know that some of my symptoms might be hard to differentiate if I've been through a traumatic experience and have also had a TBI.
Right.
Yeah. So all that to say, they can vary, but I see kind of similar kind of headaches are a problem, also a problem with chronic pain. And so I think for the veteran, it can be hard for them to tease out and say like, maybe this is my trauma, but could it have been due to the concussion? Have I had another fall or blow to the head just in daily life? Maybe I fell off a ladder and I'm not recovering from this concussion, or I had a fall. Falls are the highest percentage of types of TBIs. So in the civilian population, we think car accidents or sports. Sports is for youth, but for adults, more often than not, it is a fall. So,
Yeah, it's
just in
interesting
everyday life.
because I was thinking about that yogurt example that you were talking about. And how some of the yogurts have the fruit that's on the bottom of the cup. And if you shake that,
Yeah.
like you were saying, if you were to shake that, you would all get mixed up and it would look like yogurt. It wouldn't be the same yogurt that you would have gotten prior to shaking it. But if you left that yogurt sitting there long enough, eventually some of that fruit might start to settle back down. And thinking of that almost as like the healing process where things are sort of going back to where they belong, but they're not all going to get 100% back to where they were
Right.
necessarily. But then if you shake it again, it's going to compound things and it's going to make things even more out of place than what they should be. And so that just goes, I think I'm bringing this up, I think, because it goes to show the importance of taking care of yourself, especially after having some sort of a brain injury, because it could make things 10 times worse. Just throwing random numbers here, obviously, but it could make it so much worse if you do get a secondary or third or fourth, fifth head
Right.
injury. It's like just continuously shaking that thing of yogurt, right?
Right. And we've seen some of that research come out on CTE with football players who have had multiple concussions. And they've also talked about subconcussive blows, which could apply to military and service members as well. If maybe they didn't have a full-blown concussion, but they had a blow to the head, the nature of maybe different service members' jobs and how that subconcussive blow could have been numerous throughout their
Mhm.
service. Whatever role they had, maybe jumping from things or being shaken up in a vehicle, for example. Yeah, there's lots, I think, because it's a high-risk job and multiple chances for the brain to have a jolt. They could also have some subconcussive blows that they wouldn't have thought is a concussion.
Right, exactly. And I know just driving around in some of the military vehicles on uneven terrain, even you get jostled around quite a bit, and you could even hit your head against the window or the door or the side of the vehicle. And if you hit it hard enough and you don't have any sort of protection like a helmet or something like that, you could give yourself a concussion, or not give yourself, but you could end up with a concussion.
Or a subconcussive blow,
Oh,
right?
right.
And even if you've had a helmet, so I see the pictures of service members in helmets, but that really doesn't matter for concussion because your head is hitting against your skull. then you need about 80 Gs of force for concussion. So if that force in which you're hitting your head was in excess or near 80 Gs, then we could consider that another blow to the head, for example.
Yeah, exactly. Those helmets are, I mean, they're military grade, so sometimes they're made by the lowest bidder, and that maybe they're not designed for with that type of thing in mind. They're designed to protect against shrapnel and bullet impacts and things like that. They
Right.
maybe aren't necessarily considering
So they're more
the
for the open head injuries as opposed to
right.
closed.
Right, so they're gonna be designed more for that type of thing. I've seen pictures of helmets of service members that actually had a bullet sticking out of it, like,
Right.
they stopped the bullet, and that's good because otherwise that person wouldn't probably have survived that shot, but then again, they probably also are dealing with a brain injury just from the impact of that bullet. So, there are many different ways that these types of things can happen. But what I'd like to talk about next is some of the ways that you work with patients to treat these effects and the symptoms that they have from these brain injuries.
Yeah.
You mentioned earlier that you use EMDR therapy and you briefly described that, but could you tell us what that's all about and kind of what it entails as far as the actual therapy is concerned?
Sure. So if I can, I'd like to take like what I would start with somebody first. So EMDR is kind of one of those power therapies. It's like, it's like my big tool in the toolbox. So what I start with and what's important, I think for anyone can do this right now, is think about the springboard for brain health. So I always talk about like how can I have the healthiest brain today? And you don't have to go to an EMDR therapist to do this. But if you think about four things, they are very simple, but they're not easy to implement because if everybody did them, then we would have rock star brains and we would be, you know, like living our best lives all the time. So those four things, and probably things that you've heard multiple people talk about, but there's nuances. So definitely nutrition is huge. What foods are you eating and are those foods conducive to brain health? And I don't prescribe to telling people to do certain diets like you got to be keto to have the best, I don't believe in any of that stuff. Supplements, maybe there's some research. There's a little bit with magnesium, in brain health. Certainly like common sense, eating like generally your macronutrients. So getting your carbs, getting your proteins, getting your fats, like those macronutrients are really important for the brain. And thinking about those antioxidants, omega-3s, that's going to be very helpful to your brain. So certainly like eating fish and getting those omega-3s is very helpful to the brain, but generally thinking about like lots of fruits and vegetables, fiber is super important. We don't consider, and my steak and potato guys, I'm like, can we please add some vegetables? Because that's gonna be helpful for your mental health and for your physical health to help things move through because it helps nutrients move through the brain and the body. So often guys don't think about fiber. Some are very good with it, and others, I'm just like telling them to pour flax on everything. Like get some flaxseed and just pour it on.
They need to start eating the food that their food eats, is what you're trying to say, right?
Yeah, it's just funny conversations like getting banned with some of my guys, especially. It seems like they're like, I'll do this. And I'm like, can we just put some blueberries on top of it? Come on. I'd goad them a little bit and they laugh and we have a good moment, but they're kind of hearing me. They
Right.
get it. So thinking of like just adequate nutrition is great. Movement. I don't say exercise because, I don't want you to think this is like, okay, I got to do my PT and like run, 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 run. A lot of people reject that after service or after being an athlete. They don't want to feel like they're being forced to move, but thinking of their movement. What we know about movement in the brain is that blood flow is so important. So if we're not getting adequate blood flow to the brain because we're not moving, we're sedentary, then that's also going to not be great for brain health. That's going to make concussion, brain injury symptoms worse. It also makes mental health symptoms worse. So trauma, all of that. There's been great research in walking. Like walking is great exercise. If you have a dog, a lot of service members love their dogs, like that is a great excuse to walk. That is still great exercise. You don't have to
Mhm.
kill yourself. That's going to be great for your brain. A lot of my guys will do lifting as opposed to like yoga. Weightlifting they're finding can be really, really helpful for increasing your heart rate and blood flow, especially if you're getting in that metabolic zone.
Mhm.
I won't get too much into I'm a fitness instructor too, so I often think about like metabolic zones with weightlifting, which just means you're kind of lifting a little bit quicker to increase your heart rate. And so you do get a little bit of that cardio benefit when you're lifting, which is super
Okay.
cool.
That makes sense.
Yeah, yeah. So nutrition and movement and social interaction. So we don't think that social interaction would be for brain health, but it is. So actually, I have this graph. I can tell you the research study right here. If I can make it bigger, I don't know. I can give it to you later. I have the graph,
Okay.
but I don't have the research study. So they did this study on mortality. They looked about a number of things that can cause early mortality, such as smoking more than 15 cigarettes a day. I'm trying to look at some of them now. Alcohol consumption, so drinking like excess of 6 drinks per day. Going to cardiac rehab if you've had a cardiac event, you think that's important to do, right? So BMI, like being obese versus being lean. They also look at social relationships, so complex measures of social interaction, high versus low support, and that had such a bigger effect size than some of these other ones, like their BMI. So I think the pandemic has taught us that if we aren't engaging with other people, we are not healthy. Like I think everyone has felt some kind of depression or anxiety just due to decrease in our social interaction. It's not just interaction, it's quality. Like people, I feel like people know me, I feel seen. And I often tell people, often my brain injury survivors, there's all kinds of brain injury support groups in your state if you're in the US, but to find those, they're now on Zoom, so it's really easy. And for service members, I'm sure there is a group probably near you where you can be with other service members or veterans
Mhm.
that know what you've been through.
Yeah, I mean, even if it's not group specifically for something like that, even something like the VFW or an American Legion where you can go and just be around those people. It's a easy way to do that. It's like, walking in the door, everybody has at least one thing in common that they served in the military. That's a real low-hanging fruit, easy way to find that sort of social interaction, right?
Right. But it's really being known. It's important to
Mhm.
feel like that sense of belonging and being known in our friendships and our family relationships.
Mhm.
So the last thing is sleep. So important for brain health. If you're not sleeping, then your brain is not basically recharging. So that is super important. Many of my veterans have sleep difficulties, likely due to trauma, also due to the nature of their work in the military. So whether they were like on flight status and they had to kind of be on ready, whatever, I don't know the terms, but you had to be ready to go essentially,
Yep.
or if they were deployed somewhere and they were kind of on guard all the time, their sleep was often interrupted. And I find that sometimes getting some help with that, whether that be doing some kind of sleep study, I know it's not the funnest thing, or a sleep specialist and figure out and diagnosing what is actually happening in your sleep, what's going on, and if there's any kind of intervention that can be done regarding your sleep. So sleep is very important. Those are my 4 things that I look at before I would add on really starting doing traditional psychotherapy or any therapy for trauma, for example.
Yeah, I mean, those 4 things, they seem like they would be a just a no-brainer kind of thing. Like, just like, of course you should eat healthy. Of course you should be
Yeah.
moving, doing some sort of thing like that. Of course you should get a good night's sleep. And, all of those things seem like they should just be obvious. And when you talk about them, they sort of are a little bit obvious, but it, we tend to fail quite often at doing these things. Maybe we got a couple of them down, like maybe we eat well, maybe we get good sleep, but we're not moving and we're not getting the social interaction. And
Right.
we're not doing all of them. And so, what can we do to focus on these things? Are there things that we can do to get better at doing all of these things without feeling like we're forced to, go and do PT or anything like that? You know what I mean?
Right. Yeah, I like to think in terms of rhythms, how can you have more of a cadence of, okay, is it starting with breakfast? Like I'm really going to focus on, like, if we're talking about nutrition, maybe I'll focus on my breakfast and I'll kind of keep it simple and do like oatmeal with like walnuts, and then I'll add some antioxidants, put some blueberries in there, get some even more fiber on top of that oatmeal with like flax. And so you really focus on one thing and not try to overwhelm yourself with, I am failing in 4 areas. I have to, to fix the whole wheel.
Right.
No, it's too much to start at once, but small changes do really help. So I think focusing on one thing at a time, and I think it's important to try to make waves. So it's just part of like the cadence that I have with other people in therapy that I'm asking about these things all the time. Hey, is there someone this week that you can call and go out with and have coffee with, do something with, can you have a buddy come help you with that project that you've been
Mhm.
wanting to do, but you don't have help with? Those are examples of the social action piece, and that's often homework. Who are you calling this week? Who are you seeing this week? What can you do to start to build that relationship? Because we think it should be organic, the relationships we have, but they're not. I think it does take work, but it's
Well,
good
yeah,
work.
I mean, any sort of relationship is going to take some sort of work, unless they're forced relationships where, like a coworker kind of thing, where you have to be at work every day. And so, yeah, you're just going to have a relationship. And so it's in a way that's somewhat easier because you both have to be there. Otherwise, you don't get paid. And then you're creating other problems, right?
Yeah.
But in those other social interactions, you don't always have to do those types of things, and so it's easy to just say, "Oh, well, I'm going to skip it today," or "I'm just not going to go join this group for a walk in the park or whatever it is."
Hmm.
I'm just not going to do it today because I don't really have to, and so
Yeah.
we tend to forget about those types of things. How easy it is to just back out of certain
Yeah.
social
And I think it
interactions.
can, the trauma stuff I find is a barrier a lot of times because it's like, okay, like there's all these relationships that I want to be in, but then they're kind of scary
Hmm.
because then I'm going to be known, and then are people going to ask me things about my trauma or trigger that trauma? And I think it can be people who aren't well versed in trauma or understanding potentially what someone has been through in their service can ask questions that can be very triggering or insensitive, or just like, why would in the world would you say that kind of stuff?
Would like group therapy be a good option for someone who's in that type of situation where they don't want to deal with people who maybe don't understand what they're going through because they don't want to get those stupid questions, if you will, being asked of them. But if they're in a room full of other people who have gone through something very similar, they could probably feel pretty comfortable knowing that they're not going to get those kind of questions.
Yeah, I
Would that
think
be a good
so.
option? Yeah.
Definitely. Yeah, I think, the group therapy and peer groups, like military groups that, are tailored kind of to veterans, even if there's not the focus of talking about trauma, but the focus is whatever it is, whatever that group, maybe they're
Right.
working on some kind of charity project or something like that.
Yeah, and I find that with the military groups, the people that you talk to in the military, you're not going to get those kind of
No, I don't.
questions. We kind of get it. Like we know if you've been deployed, there's a good chance that if you've been in combat, I should say, there's a good chance that maybe you did have to kill somebody. We're not going to
Right.
ask that question. That's not a question that we care to ask. We don't want to know the answer, quite frankly. Like that's
Right. We
not
know better than to, lead with something like that or talk
right.
about something like that.
And that's something that um, I think someone in the civilian population may not realize that's a triggering question. That's not something that you should ask. It just isn't the best question to ask, I should say. And so, finding your group of people that understand you, understand what you've been through and your experiences. And yeah, I get it. Nobody was standing in your shoes at that point in time doing the exact same thing that you were doing, but they have their own experience and they can kind of relate and understand where you're coming from when you're
Yeah.
talking about stuff that may have happened or even not wanting to talk about it. They can understand that too, I'm sure.
Yeah. Yeah, that you don't even have to go there. Like that's not
Right.
even something you have to talk about or be part of your relationship. You can keep that if you just want to keep that to your therapy or,
Yeah.
whatever box you keep locked away in your head. Yeah.
Now,
So maybe it's a
w-
good segue to talk about EMDR a little bit.
yeah, I think so. Yeah. So I'd like to know more about like what the actual process is. So if we covered all these four steps, we have the nutrition and the movement and the social interactions and the sleep, and we kind of have that stuff in a pretty good place. What does EMDR look like when someone comes in for these types of sessions? What can they expect?
Yeah. So I think for a trained EMDR therapist, you can expect that, I'm going to go at the pace that you want to go at. So and I can kind of run through like the first phase of EMDR is history taking. And that can seem like really daunting to someone who's been through something very traumatic. And my training is that I'm not going to get details of your trauma in that history taking. I just want to know, like, hey, what is the category of what the things we're going to work on? Okay, what is that category? Okay, that's the category. And then we go to resourcing. So that's phase 2 of EMDR. We're really going to create psychological resources for you. Those would be like developing a comfortable or calm place where internally you can go to if something is too distressing or destabilizing. So that can be like as simple as your backyard. It can be imagined place. Like I'm just going to imagine a place like I'm on top of a mountaintop and I'm going to take all that in and enjoy like kind of the nature pieces. And it's multisensory. So we're going to bring in the five senses. Okay, what does it feel like when you're there? What does it smell like? All the different things. And then where do you feel that relaxation in your body when you're there? So I think as I say that, your shoulders are dropping a little bit. I'm getting my therapist voice, So we're really trying to tune the nervous system again because it knows what to do. I think the key I want to tell people is that your nervous system knows what to do. Sometimes it can get stuck. It might have been stuck for a very long time into sympathetic. So there's two branches of our autonomic nervous system. There's a parasympathetic and there's a sympathetic fight or flight. Gotta do it, gotta go. We know what sympathetic is. So we're trying to engage that rest and digest system, and we all have it, even if we haven't had a very restful life, even before the military. Some folks, I know it's harder for them if they, had childhood trauma on top of their military related trauma. So they're like, I never knew what safety was. Okay, then we have to create that safety. We have to figure out like, what does it even mean to feel comfortable? Maybe not even safe. Maybe it's just this is comfortable. Like I'm in my backyard, looking at my dog. That's good. I'm comfortable. Okay, we can start there. So you can just start with comfortable, and that if that's all you can do, that's good. We do a lot of different things in phase 2 of kind of relaxation training. I don't know if anyone's ever talked about 4 square breathing. Let's breathe through our
Mhm.
square. Breathe in, breathe out. Hold on, release. That's your square. Lots of different tasks that we do. And then phase 3 is we've already then gone through the different things you want to work on. So we're going to identify, okay, what are the different targets? We call them targets or memories in EMDR that you want to work on. So we'll have a target sequence, and usually that is the first experience, the worst experience, and the most recent. And we usually in EMDR, we start with the worst. And that's like, I'm starting with the worst. That's scary. I know. But we can really take that worst experience and take it into chunks. Like, okay, maybe we just take one part of it. Part 1 was this. And I'll give an example of a car accident because it's a civilian example, but I think maybe they can take any accident, right?
Right.
So maybe the first part was seeing the car come at you. That was part 1. The middle part was seeing the glass crack. The last part was after the accident and like being in shock. So I've had people even break up that worst experience, and I call it like titrating it. So we're just going to take it in chunks, and each one of those has been a session for that particular person. And the idea with EMDR is we want to stay in a window of tolerance. So if you feel like you want to run out of the room and never come back and see me again, I have not done a good job. So I want you to feel like this is manageable. It's uncomfortable, but I can do it. I'm still present with you right now. I'm not fully in my trauma. I don't feel like I'm there. I feel like I'm with you. And if you, for whatever reason, if someone doesn't feel like they're with me in the room, I'll say, let's take a minute. Maybe we'll do go to calm place. Maybe we'll use an exercise I do called the container where we have an imaginal container where we'll put things or experiences in that are keeping them from processing the trauma or as a block. So it's another tool that I use. So phase 3 is when we identify the picture, what the picture actually is. If we'll just take this car accident example, the worst part of it was when the glass was flying at me. What was the negative cognition? I'm out of control. What do you want to feel? That it's over. That's the positive cognition. How much do you feel that? Oh, I don't feel that that's true at all. So that's like a 0. Okay. What's the emotion? Fear. Okay. 0 to 10. How strong? An 8. Okay, it's pretty high. Where do you feel it in your body? All over the place. In my chest. Sometimes we feel chest, throat. From there, we'll go to desensitization. That's phase 4. And that's where they're 1 foot there, 1 foot here with me. And we use eye movement or bilateral stimulation. So that's, if you're with me, I would say I'm moving to the side so you can see. But you would follow my fingers like that. Or we use taps. Or we can use tones. There's lots of different types of bilateral stimulation. The thinking in the model, Francine Shapiro founded EMDR by walking when she was experiencing, like trying to process her own trauma. So she was walking and she found that the movement helped for whatever reason. And I think there's culturally, there's lots of different examples of using drumming or other bilateral movements to kind of help trauma move through them. The eye movements, interesting with the brain, because much of our brain is, acclimated to visual processing. The eye movements have been shown to move more quickly through the trauma. However, because I specialize in concussion, some of my concussion people cannot tolerate visual eye movements. So I'll use tapping or I'll use other types of bilateral movement. I even had one concussion client who couldn't even tolerate any touch. They would just kind of rub their shoulders like this. Okay. My guys, sometimes for tapping, they don't want to, do these shoulder taps or a butterfly hug. So I say, okay, well, no one knows if you're tapping your knees, right? Just tap your knees, one then the other. And they can do that bilateral stimulation on their own. And we use that in Calm Place. We use that throughout the model as we add tactile touch or the visual side-to-side movement of the eyes.
So is that something that they can do just on their own? It doesn't necessarily need to be in a set with you or, whoever they happen to be working with, right?
Yeah. So I would ask them to do in between sessions, Calm Place exercise and a relaxing strategy. I don't have them process trauma on their own. Okay. So it's more for the relaxation that I'll have them do their own bilateral stimulation, whether that be tapping their knees. And there's lots of different, I feel like I want to do some on YouTube or something, but there's definitely some YouTube of Calm Place that I can give you a link to. The Center for Creative Mindfulness, I believe, has a lot of those exercises on YouTube for free that they could do. And that's part of the phase 2 of EMDR. So we're using that throughout. We're using the resourcing. We're helping if something becomes too distressing. We take a break always. And every 60 seconds, we're taking a pause. I'm saying, take a deep breath, let it go, rest. What do you notice now? And so maybe we started with that picture of the glass flying. And each time, sometimes it changes, sometimes it doesn't. But maybe at first, it kind of, doesn't move as much. And then there'll be a moment in the processing where they say, oh, well, now I'm thinking about what I was, seeing that person and feeling like I'm totally out of control, that I'll never be safe. Okay, let's notice that. And they go back to processing. And if they get stuck on there, so if they I'm really, really stuck. Okay, well, let's bring one of your resources in. Maybe we've talked about a nurturing figure in their life. Remember your aunt, Sylvie. I'm making this stuff up. Can she be there with you? Okay, put Aunt Sylvie on your, she's like kind of sitting next to you as you're going through this. And we'll go again. And so Aunt Sylvie's there. Okay, that really helped. Aunt Sylvie kind of patted my back as I was there. So we're actually reimagining the trauma in safety and using resources as we need them. And so the resources are different for each client. Like it really depends on the person. They look very different for each person. And so that's the fun part, is exploring and getting to know like what helps them feel comfortable and safe, what types of people have helped them feel safe in the past. So that's the kind of cool part of EMDR, which I really love. So phase 4, desensitization is what we call it. And that's we have that image and we need to desensitize in our body that it's not happening right now and it's in the
Mhm.
past. And at the end, if everything has gone beautifully, you have a zero distress to that target that we started with. And then we go to phase 5, which is the installation of the positive cognition. So I'll say, okay, you have that. Remember the event we started with? Yeah. Okay. What do you notice now? Well, yeah, I just feel like it is over. So, okay, does that the positive thought? Yeah, it is over. Tap that in, use your eye movements or do your tapping. Great. So we really install that positive cognition that is over, or I can manage it. I'm okay now, whatever it is. These are different positive cognitions that I've done with people that they've come up with on their own. And then phase 6 is body scan. So we always end with the body. So we do I'll say from your head all the way down to your toes. I just want you to do a scan of your body and just let me know if you feel any tightness, tension, or unusual sensations. And usually most people don't have any. Sometimes they do. If they do, I go back and I'm just like, okay, let's see what that is. Do the body scan again. Sometimes they're still stuck. Their body's still stuck and we have to either do that in another session or do some more processing. 7 is closure and 8 is reevaluation.
Okay.
It's hard to explain. Hopefully that was a good explanation of EMDR.
Well, I think it is because I've heard of EMDR before. I've looked into it, but I've never had a really detailed overview of what takes place during all of these sessions. And approximately how many sessions does it take for your average person to get through the EMDR treatment? I know the answer is it varies because everyone's going to be a little bit different. Someone might be stuck on something; it might take a little bit longer. But on average, what would you say
Yeah, on
it is?
average, I would say of actual reprocessing sessions. So when you get to reprocessing, depending again, like if someone has complex trauma, there's multiple traumas, there's childhood trauma too. We're talking about like 24 to 48 sessions.
Okay.
If it's a single incident trauma, it might take just a few sessions and they are good. If they've had a pretty normal childhood, there's maybe been just a couple of traumas that they've experienced, maybe in the military. My experience hasn't been necessarily that. With many of my veterans, there's a lot of incidents. And so it's taken a little bit longer for them. But I find that people functionally feel a ton better after 8 sessions. So doesn't mean you have to stay in EMDR treatment forever. Like you can say, maybe I want to work for this one memory or 2 memories and really feel like I'm feeling a lot better. You can do that because I want people to feel like it's accessible. It's not overwhelming. Like I can do this.
Right. And I think another thing to point out is that it's not that the memory necessarily disappears. It's not like you're erasing someone's memory, like Men in Black with the little wand thing that they had and
Because everybody
basically
would be
zapping
healed if I had a wand.
exactly. If you had some magic tool like that, we'd all be, just we'd all be happy. Nothing
I wish I
be
did
bothering us,
because
and you would work yourself out of a job, and that would be
yeah,
a shame for you and everything. But
right.
I think it's important to note that because there are certain things that, yeah, sure, we would like nothing more than just forget all about it. But there's other times when some of those traumas are sort of defining moments in our lives and we don't necessarily want to forget about it. We just don't want it to control our lives and
Right.
take over everything.
And I
The
would
death
say
the death of a friend or something like that. It could be something like that, or a loved one or whatever. That could be a very traumatic thing, but you don't want to just forget about that person either. So it's I wanted to point that out because it's not that, you're not going to totally forget about it, but you're going to deal with it in a better way than you maybe were, right?
yeah. So the goal of trauma therapy is to feel like in the body that it's over. So the problem with PTSD is it feels like it's happening right now.
Mhm.
So we want to feel like in the body it's not happening right now. And
Right.
so you'll still have those memories, you'll still have that sadness and that difficulty with the memory, but it won't feel like my heart is racing. I'm I don't know how to control my breathing. That's what it feels like when that trauma gets triggered. And so the goal is really to feel like it's over.
Right. So you're not feeling like out of control, like,
Mhm.
why is this happening now and all that kind of stuff. Like you're not going to have that experience
Yeah.
going forward, right? So, and that's the goal anyways, so I think that was a great explanation, and I'm glad that you brought that up because I've heard of EMDR therapy. I'm sure a lot of the listeners have heard of it as well. Usually with regards to PTSD is where you hear about it, at least in my experience. But it's good to know that there's other things too. Like there's a lot of different traumas that people experience. Things
Yeah.
like you said, a car accident or things like that, which is a traumatic experience, but it could affect things like having a brain injury. And this type of treatment could help with that to process those things in a healthier way than maybe just saying, "Ah, you know what? I'll deal with it. It'll get better on its own." And because I think we all know that's probably not true in a lot of cases, right?
Yeah. Yeah. I just wish that service members would have had treatment earlier because it's just so hard for me when I see someone that has had this, been carrying this trauma for 20 years
Hmm.
for or longer. And it feels like I have to carry it this way.
Yeah.
But there's a different way to hold it. I feel like if you carry it like the boulder that it can be, it's just going to it gets get heavier and heavier and heavier. And you don't have to hold on to it in that way.
Yeah, and if you want to think about it like that, maybe not even a boulder, because a boulder is something that you can't even pick up to begin with necessarily because
Yeah.
they're
Yeah.
just massive. But
I
if you were
love
just
metaphors.
yeah, no, but if you were to hold just a book out in your hand and just hold it straight out, at first you're going to be able to do that. I think everyone, unless you have some sort of medical condition, you could probably just hold a book
Yeah.
out for a little while, and eventually your arm's going to start to get tired, and it's going
Yeah.
to start to feel like you can't hold it. It's the same book, nothing's changed. It's just you've just been using that same muscle or same muscle groups over and over and over for a continued period of time, and you're not going to be able to continue to hold that book up steady anyways. And so eventually you're going to have to do something to change that. Either get something to support your arm to keep it held up, or put the book down. And so you have to do something to change that. And I think that's a good way to think about, our mental health is, yeah, we can maybe push through a tough time for a little bit, but eventually we're going to need to get some help because we can't
Yeah.
keep holding on to that forever. Eventually, we're going to need some help processing or dealing with whatever it is that we happen to be going through. So, this has been really, I think, a great episode talking about the various symptoms that people might have from brain injuries, talking about the different therapies and stuff. And I'm sure that we could probably go on for hours talking about the different types of things that are involved with brain injuries, but I don't want to take too much time with this particular episode, but maybe we'll have you back on for a part two type of episode later
Yeah, I'd
on
love to.
to kind of go a little bit deeper into some of this stuff. But where can people go before we wrap this up? Where can people go to either get in touch with you or find out more about the types of things that you offer? Maybe you're not offering it in their area, but maybe at least that gives an idea for what people can look for closer to their area.
Sure. Yeah. So I am at tbitherapist.com. So that's my website. And I am now licensed in telehealth in 34 different states. So I'm trying to update my website to show what different states. It's a PsyPact. It's called for psychologists. They've just let a lot of us do telehealth in different parts of the country. So if you're in the US, I might be able to work with you in your state. So that would be
Excellent.
awesome. I also do coaching for brain health. So if you're not in that area, I do some coaching for brain health and just optimization as well. So if you're just wanting your brain to work better, let's chat for sure. I also am the host of TBI Therapist. That's a podcast that's focused on recovering from concussion and brain injury. So if you just want some more tips on that, you can listen to that for free.
Absolutely. And I will have links to all of this in the show notes so that people who are looking to get in touch with you to find out more information about the telehealth, if they're not in your area, and also to listen to the podcast, I'll have links to all of that so people can check that out. Thank you again. I really do appreciate your time and your work that you do helping people with these injuries. Really, I think it's important work, and really do want to just commend you for all the work that you are doing. So thank you very much.
Thank you. This has been awesome.
Thanks for listening to the Drive On podcast. If you want to support the show, please check out Scott's book, Surviving Son, on Amazon. All of the sales from that book go directly back into this podcast and work to help veterans in need. You can also follow the Drive On podcast on Instagram, Facebook, Twitter, LinkedIn, YouTube, and wherever you listen to podcasts.